Hey, what's going on, guys? I wanted to put up a quick video on basically what a home exercise program would look like for tennis elbow. So this is going to be like start to finish. We're not going to talk a lot about the pathology or the anatomy of behind the injury or the issue. We're just going to look at like what to be doing for this to manage it at home. If you've seen me for this before and I gave you a different version, just realize that version was applicable to you. This is a good general rule of thumb for most people struggling with this issue, especially if it just started up or if it's in the early stages. It's not too bad yet. We kind of want to just go through this systematically to warm up the tissue, load the tissue, stretch the tissue, and then maybe also I'm going to add a bonus tip on thinking about the nervous system as well, and maybe mobilizing that nervous tissue in and around the muscles. So first things first, we're going to kind of warm up the tissue. You need some kind of buffer on the tissue or some kind of lubricant so that you're not giving yourself just like an Indian burn here on the arm. I just use coconut oil. This is just, I mix up my own coconut oil and essential oils. Are the essential oils necessary? Absolutely not, but the patients like them and it smells better. Maybe it has a little bit of extra blood flow effect, but all we're gonna do is just get like a really light sheen on the forearm, just so you're not, again, just scraping your skin to death. And then we're just gonna work from the front around towards the back with about 20 strokes from proximal to distal. This right arm, if I'm treating, this whole video is gonna be treating my right arm. I'm gonna keep it totally relaxed here, and I'm just using a light open fist with my left hand, and I'm just kind of scraping the tissue down, going with the grain of the muscle fibers here. And all you cross friction massage folks out there are going to hate this, but just going down with it. It feels good. We're just kind of warming up the tissue, trying to bring some blood flow in there. And we're going to get about 20 strokes. Try to centralize the strokes predominantly to the part of the forearm where you are getting your stuff. Wherever you feel the most pain, don't cram it in there too hard, but it's a good way to just kind of bring blood flow into the tissue, warm it up a little bit, so that as we start to go through our loading and stretching, we're not doing that with cold tissue. This also helps to break up adhesions, if you believe that. I know the research is debatable, but whatever is happening physiologically, it creates a really good clinical outcome. So that's why we do it. So that's step one. We're going to warm it up. Step two is load it. Here's the thing. We're going to do wrist extension and wrist flexion. But if I'm having a problem with my wrist extensors, I actually like to train my flexors first. And that is to actually create an active stretch on the wrist extensors. We're going to stretch these guys later anyway, but just going through active range of motion wrist flexion stretches the muscles on the other side. So I like to just, again, lightly close my fist, apply light tension with my left arm. And this is going to be like isotonic tension, or basically the idea that we are not changing. I'm not doing an eccentric where I bring it up and then I only apply pressure on the way down. I'm just keeping a moderate load of pressure the whole time up and down for 20 reps. And I'm doing this way in a supinated position. I'm going to do the other one in a pronated position. Don't overthink it. We're just wanting to load the tissue outside of pain. I'm not pushing so hard that I'm causing myself pain. Okay, if I was, we would lighten this up. This whole thing is meant to be relatively pain-free. So 20 reps, flip the forearm over, light pressure here, and another 20 reps. Notice I've got my arm on my knee so that it's relatively relaxed, other than the fact that we're just activating this muscle in the forearm. Same thing here, lightly open fist, 20 reps like this. Now, if this is really valuable for you, which we may or may not talk about if you're coming in to see me, I might have you do 3 sets of that. But for right now, we're just going to say 1 set for flexion, 1 set for extension of 20 reps each. And then we're going to look at going on to the next phase of this. So we kind of warmed it up. This was kind of the loading portion. And again, a lot of times I'll give out other postural exercises. If you've ever been in to see me for tennis elbow, you know it is not just a forearm issue. It's the whole chain from neck, shoulder on down. So those exercises are going to be more applicable to you. This is just covering the forearm stuff. And even just feeling this right now, like this forearm is warm from what I've just done to it. I've scraped it, I've warmed up that tissue, like it just physically is a little bit warmer, which is a good spot to look at stretching it. So before we go into any kind of tissue stretching, where I'm really going to be actually loading the muscle tissue, this is where I like to look at the nervous system. So I'm going to pause the video, I'm going to move, and then we'll come back and we'll look at the muscle stretching at the end, okay? All right, guys, so we warmed up the tissue a little bit with soft tissue mobilization. We did some wrist flexion, some wrist extension to kind of internally warm and load up the tissue that way. And then before we go to muscle tissue stretching, we're going to look at working on nerve tissue, flossing, gliding, excursion, to allow for more freedom of movement within the nervous tissue throughout the muscle tissue. This is an important component that I feel like is often overlooked, but all the muscle tissue is always supplied by a particular nerve structure. A lot of times as the muscle tissue gets tight, that nerve gets restricted throughout the tight muscle tissue, and it can kind of cause other problems and actually maintain that higher level of muscle tone because we're getting dysfunction or abnormalities within the nervous tissue. So regulating that nerve tissue excursion and making sure that that nerve is tension tolerant is really, really important. And this can help a lot with that. So we're going to kind of wind up the nervous tissue. The radial nerve is the nerve that innervates all of our forearm extensors, so that's the one we're working on. So I'm going to walk you through the components real quick. We're going to make a fist. We're going to keep the arm pronated, so your palm is facing the wall behind you. Make that fist. We're going to flex the wrist, and all of those components need to be held at this point. The forearm is in pronation, the wrist is flexed, and the fist is maintained taut throughout this whole time. We're then going to drop the shoulder. This already may start to give you tightness in your forearm. If that is the case, that's your nerve glide. You're just going to raise and lower the shoulder with all of these other components maintained. And that's fine. That's your nerve glide for right now. If you want to do a nerve floss, the head is going to follow as we reach down toward the floor, because that is lengthening it from below, slackening it from above. If you get to that position with the shoulder dropped and you don't feel a lot of tension, we're going to leverage it out to the side. This allows for more nerve excursion from below. That's where I start to get more tissue tightness. So I'm here. As I move out to the side, I can start to feel all the tissue in my forearm get really wound up right about that point. And this can be a good retest for you in terms of if you're getting looser or not, how far you can get your arm away from your body. So one more time, we're going to pronate, we're going to make a fist, we're going to flex it, we're going to drop the shoulder, and you are gently going to move the arm out away from your body and let the head follow if you're trying to do a nerve floss. And this is lengthening it from below, slackening it from above, or simply go out and back to the point of tension if we're just working on a gentle nerve glide. Another version for the floss would be to rotate and follow it that way. But we're going to work on 20 to 30 repetitions there to just make sure that the nerve is moving freely throughout the muscle tissue. Then we're going to go back and work on the soft tissue stretching component, so I'll meet you back on the table for that. All right, so we just warmed up the nervous tissue. We got that nerve moving well throughout the muscle tissue. Now we're going to look at how do we actually stretch the forearm muscles. And there's a couple ways I like to go about this. So if I'm stretching my right arm, we're going to reach it out straight. We're going to pronate it, so turning your palm down. Then I'm going to reach over the top of it with my left hand, and I'm going to gently pull it back towards me. Okay, so this is stretching my right side. I am pronating it, I'm reaching over the top, and I'm going to pull it gently back towards me. This is a light hold on the tissue. These are not big muscles. They don't take a lot of energy to stretch them. So we're just going to hold 20 to 30 seconds with like a 2 or 3 out of 10 discomfort. Very lightly here. Let it relax. Let it kind of wiggle out. And we would go back in and repeat that. That's stretch number 1. That's looking at lengthening on a pronation effect and just kind of stretching it all throughout the back of the forearm. The second one that I really like to do, we are going to keep it supinated. I'm going to see if I can kind of do this here in front of the camera. So keeping it supinated, we're going to make a fist, and then I'm going to cover that fist up with my other hand. I'm going to bend it towards me, so I'm flexing the wrist, and then I am gently straightening my forearm while maintaining those two positions. I've got the fist, I'm bending it. Now this arm, once I bend it, this right arm goes relaxed, totally relaxed. And I'm kind of pushing it down with my left arm, making sure that that fist doesn't pop out on the right side. And if I'm actually doing this for real, guys, I'm doing it down here. That's just where I do it. So I'd be making a fist, bending it back towards me, and then gently pressing that down towards the floor until I feel a good stretch right up the back of the forearm. Again, very gentle, but just in the right place. Hold that 2 rounds, 30 seconds, and then let that kind of come back up and relax. So, you know, it really, that program doesn't take a very long time to cycle through, but it does a really good job of just preparing this tissue for whatever you're about to do, whether that's field hockey, whether it's lifting, whether it's tennis, whatever it is, where we're about to load that tissue and ask it to perform. This is more of a warm-up routine. I want you guys doing this at the beginning of whenever you're going to perform or play or whatever it is that you're about to do that you typically get your pain. The other home rehab exercises that are specific to you can kind of be done at any point in time. But if you are working on a postural component to this, I would strongly suggest performing at least a couple sets of those before your activity, not enough to wear you out, but enough to just kind of prime your postural muscles to keep you back in the right positions before we go into perform. So hope this video was helpful. If you guys have any questions, please feel free to message us, and just stay tuned for more videos like this, or if you have anything specifically that you want me to cover in the next video, feel free to let us know. Thanks, guys.